Hi, John. Welcome back to 10 by 6.
Hi, yeah, glad you to be asked.
Well, lovely to see you. And for those who don't know, this is Dr. John Orrell, GP in Weymouth. And I'm delighted to speak to you today because I understand that tomorrow you are actually retiring. So
Yes, it's a
congratulations.
weird feeling. You said you work away for 35 years as a GP and suddenly you're the oldest person in the building, so time to go. But good news, we've got some great new doctors coming in to fill my shoes. Obviously, it takes two to do my job, so that's what's happening.
I understand. Yes, good. Well, so your patients will get two for the price of one.
They will, and improved care, I'm sure.
Well, thanks, thanks, John, for 35 years of helping with the health of thousands and thousands and thousands of people locally, and for all you've done for the NHS and people locally in Weymouth. And we wish you a very happy retirement.
Thanks very much. I won't be idle. I've got lots to do with the council and Tumbledown Farm therapeutic work. So, but enough of me.
Okay. Well, yes. So invited you on to have a chat about a couple of aspects to do with health. And the first one was that there was a very interesting article in The Guardian about life expectancy and how that varies due to various factors. And it focused a little bit on sort of ethnicity and how some white and mixed ethnicity people can have a lower life expectancy than Black and Asian groups for various reasons. But it also highlighted some of the factors that can lead to a lower life expectancy. And just wanted to ask you your opinion on that as a highly experienced GP about some of the factors that you think can affect people's health while they're alive and their chance of living a longer or a shorter life. John, what's your thoughts on that?
Yeah. So yes, it was an interesting report which I read as well. Going down into the detail, there was increased life expectancy in some ethnic groups, which they put down to a better diet. So some people coming from a culture which is used to cooking food from scratch did better than other populations which have come to rely on highly processed factory food. And they saw over the generations that as cultures became more westernized, so their health deteriorated. So that's a lesson to us all. Yeah, that report was interesting. What I see is to bring it in with other reports that have come out recently to see where it fits in. And there was one produced by Chris Whitty, famous man on the telly, 3 weeks ago, looking particularly at seaside towns and deprivation, of which Weymouth obviously a prime example. And they've become across the country kind of sinkholes. So there's been kind of societal cleansing, a lot of billionaire flats going up in London, and populations being shifted to Blackpool and Margate and Weymouth and places. And we're really seeing the health impacts of that through inequality.
And that brings us on a bit to housing, social housing, and things like there's quite a big disparity in terms of your life expectancy depending where you live. We see that nationally. Well, what's the situation with that locally? What's the local picture, Doc?
Well, it's really quite stark. Our practice that covers. Oh, is my phone going off? I just that out the door. So yeah, my practice covers. We got Central Weymouth, which is Melcombe Regis, and then Preston, which is only a few miles away. Adjoining wards, same group of doctors, but the difference in life expectancy is getting on for 10 years. So that's clearly down to deprivation. So because the healthcare is the same. The housing is quite different, the employment, the living conditions are vastly different, and it shows in how long people live and how healthy they are before they die. Because death is one thing, but there's often people are unwell for 20 years before that. So it's quite stark.
Wow.
We like to believe that as doctors, we kind of imagine that we have a lot of influence on healthcare, but we don't actually. We have about 30%. we're outweighed by about 40% by living conditions, which is often thought of as lifestyle factors, which are individual, like eating and smoking. But it's not really just a purely individual choice, because if you're poor and you haven't got much, you have to live you can't afford a nice house in Preston. You end up at a cheap bedsit in Weymouth where the rent is cheap. And then what happens is you can't get the good deals at supermarkets. You rely on the corner shop. The air you're breathing is full of diesel fumes. So it all kind of crowds in, and it creates an unhealthy environment.
That disparity is extraordinary. I mean, for those of us that live in or know Weymouth, we're talking about a couple of miles away from each other, those two areas, and there's a difference in life expectancy of up to 10 years. That's really extraordinary, stark statistic. It really is. So thinking of some of the main things like alcohol, smoking, obesity, which has obviously risen a lot over the last few decades in this country, as it has in America. I suppose I could ask you, as a sort of retiring GP, what would be your messages, given that people are sometimes constrained by financial and other aspects, but what do you see as the sort of dangers for people in terms of their long-term health by those, if you like, lifestyle factors or choices, and what kind of messages would you say to people about trying to stay healthy?
Well, yes, the obvious measures, the individual ones, is choosing a healthy diet and avoiding addictions. But that puts it down, which makes a certain degree of sense, and that's as far as some thinking goes. But that takes the choices down to very much an individual choices. If people choose to be unhealthy and can easily make the choice to make those changes, and it isn't as easy for people living in deprived areas. Because in fact, there's a kind of what happens if your life choices are constrained, you're chronically stressed, you haven't got much money. The cheapest way to fill yourself up is with carbohydrate, pizza, bread. It's quite expensive to go and buy the avocados and the fresh veg. So because of the area one's in, then one's choices are limited. And same with addictions. If people are chronically stressed by not having enough food to eat or being cold, then they sometimes turn for a few hours relief to addictions. And if their life was less stressful, they wouldn't need to have the addictions. There's a really great study on this with rats, of all things. There was something came out decades ago with rats being addicted to opium in an experiment in a cage, and they give them a choice of healthy water or opium. They drank the opium and they died. And it was, isn't opium terrible? And then someone repeated the experiment with the opium and the water, but the rats instead were in a rat paradise with plenty of fruit and vegetables and other rats to play with and lots of wheels. And then they didn't even touch the opium. They just went the water. And so it turned out that the addiction was entirely driven by their living conditions. And when the living conditions improved, the addictions vanished. So we shouldn't blame individuals necessarily for bad choices, because their choices are limited by the environment which they're in.
Yeah.
So the big message there is it isn't just a matter of blaming an individual for bad choices. We have to create a much bigger place to live, decent jobs, availability of food, decent wages, proper benefits. Like if you're thrown out of your job, you don't starve for several months while universal credit grinds its way to giving you a meager pittance. You need to be looked after straight away so you can afford to eat. So there's all those things which are much bigger, and we can't have a healthy society unless we get all those bigger things: the housing, the benefits, the food, the employment. And sadly, in England, the last 10 years, it's kind of going the wrong way.
Yeah.
We've had 100 years of every year life expectancy improves. You know, you kind of expect your children to do better than you, and you do better than your grandparents. Life just gradually improves over the decades, and it has done for 100 years, but no longer. Around about 2015, all the effects of austerity started hitting. And now people aren't living as long as their parents, and we're starting to see life expectancy fall, particularly among deprived communities and women. And it just shouldn't be like this. We're still one of the richest countries in the world, but what's happened is the gap between rich and poor is widening, and the poor are paying for that with their lives.
Wow. I mean, that's shocking, isn't it, that there's been 100 years of increases in life expectancy and no longer, you know, going down, particularly for certain people. That's really shocking. And yeah, thanks for setting all of those health sort of issues in a societal context rather than sort of focusing on the individual, because I think that's everything you said there was so important for how we try to organize society for the benefit of people. That was fascinating, John. Thanks. Before you go, oh, and I just wanted to mention that just picking up on the point you made there, that the prior to the pandemic, I think late 2018, I think it was, so about 3 years ago, the British medical journal Open published a study that suggested, you know, strongly suggested that around 120,000 people had died prematurely, had died early deaths as a direct result of the government's austerity measures. So, given that, you know, arguably given that 120, you know, 130 odd thousand have officially died from COVID, and arguably the government's poor mismanaging of the COVID pandemic, that's actually the second lot of 120 odd thousand people that have died as a result of decisions made by this government, arguably. Would you agree with that assessment? or
No, no, I've observed that, Riley, as well. You have with two old Etonians who have both competing with each other in the death toll, which is a pretty morbid and grim thing to have to watch.
Yeah.
And through both of them, what's exactly the same dynamic has been shown, that money is taken away from the poorer end of half is losing money, and it's being concentrated at the top. So with austerity, we closed libraries, we cut benefits, we cut children's centres, and for what? So that the bankers could get their bonuses back. So the rich got richer and the poor suffered. We've seen the same with the pandemic. Lots of workers on 0 hours contracts couldn't isolate. They had to go back to work. They put themselves at risk and they died. Well, at the same time, we a horrible sight of these contracts going out to landlords and best mates of government ministers who've made a packet, bought themselves mansions, delivered crap PPE, which has had to go in the bin. And the same thing, money is being made by the super rich while the population suffers. It's shockingly bad.
It's extraordinary, isn't it? And economists have described the last 12 years as the biggest transfer of wealth from the poor to the rich in the history of our society.
Yes.
Quite extraordinary.
Yeah, it's the opposite of Robin Hood at the moment.
Yeah.
We steal from the poor and give to the rich.
Absolutely. And those COVID contracts which have gone to friends, relatives and friends and donors of the Tories, if people want to know more about that, I recommend people look up the Good Law Project, who are seemingly just about the only people holding this government truly to account, and by managing to get some of the details of those contracts, which are secretive, managing to get them published or public, taking them to court for making illegal, secretive decisions about these contracts, and winning cases against the government. You know, the government have found repeatedly in court to have lied and acted unlawfully in the handing out of these vast contracts to their mates. So, and all the details of that can be found if you follow the Good Law Project online on social media. They're doing very, very good work. Before we go, John, I just wanted to ask you something related to COVID and how children can be affected. And obviously we know that children, thankfully, thus far, have been seriously affected at much lower rates than older people, and that child deaths are generally extremely low. However, I've done some research and discovered that the official figures for child deaths directly from COVID in the UK, it currently stands at 25, but in the US, it's now grown to 452. Obviously, they have a larger population, but even so, percentage-wise, that's a much higher rate. And in Brazil, it's reckoned to be around 2,000 children have now died from COVID, 1,300 of which are babies. So again, a much higher rate. And it's thought that some of the reasons for this are around poverty. The medical experts have looked into this and said the main reasons are around poverty and nutrition, but also access to healthcare. So I wonder what your thoughts on that, you know, and what the messages for us as a society might be from that, John.
Well, it's just another fresh example of what we've known for a long time. When you look right across illnesses, be it deaths in pregnancy or other childhood illnesses, immunization rates for children, you know, preventing meningitis and all sorts. Countries where you have to pay for access, it's great if you're insured, it's great if you've got but it's absolute disaster if you have to pay. So what we in England, if your child is sick, you don't have to wonder, can I afford to take them to the doctor? Whereas if you're in America or you're in Brazil, that's your first thought. So you don't go, or you don't go in time. So it's a real warning to us as a country. We've been handed this NHS by our forebears after the Second World War, who fought for it with their lives and gave us this precious thing, which looks after us. So we don't have to worry about our health. We know we can be looked after. And yet it's actually under threat of moving towards the American system. That our leaders seem besotted with bringing in American firms. They bring them right into the heart of Whitehall and the government and take advice from United Healthcare and all their subsidiaries. The warning is there clear. We don't want to go that way, and yet our leaders want to take us that way. We need to take note. We need to fight.
Absolutely. Well, that's a great message to end with. If people want more information about how this government actively selling off our NHS and engaging American private companies in the running of our NHS for profit, people should look up Dr. Bob Gill, who's written extensively and talked extensively on this issue. So yeah, well, you know, as you've said before, John, our NHS is precious, is vital for us as a society, and we've got to fight for it, and we've got to do that right now because it's in serious danger. So thanks ever so much again, John, for joining us and sharing your thoughts on that. Some really important messages there about health and how we make choices in society to help keep people safe and healthy. So thanks again.
No problem. A pleasure.
And well, on behalf of all our viewers and the people of Weymouth and the people of Dorset, you know, thank you so much for your many years of service as a GP, and we wish you all the best with a very happy and long retirement, John.
Thank you very much.
All right, well, look after yourself and I'll see you soon. Thanks, John.
Bye then.